afternoon and welcome to our discussion of why your children need to be immunized. These pictures show a totally vaccine preventable disease called chickenpox. The older gentleman has shingles, the younger children have chickenpox. If they had had their immunizations, they wouldn't have the incredibly painful blisters and the scarring that comes from there. Vaccines work to decrease illness, they work to decrease healthcare costs, and they work to eradicate disease. Diseases that vaccines can prevent can be dangerous or even deadly. The vaccines can require hospitalization, and they reduce the risk of infection by working with the body's natural immune system to disease. Vaccines do decrease illness. This is an iron lung that we see. In the 40s, 50s, and even into the 60s, polio would cause paralysis, and these poor people would be stuck in there to be able to breathe. I remember when the first sugar cubes came out with the polio vaccine, we all rushed to be immunized so we wouldn't have a similar fate. Immunizations have had an enormous impact on improving the health of children in the United States. Most parents have never seen the consequences of these vaccine-preventable diseases on a child or a community or a family member. While these diseases are not common in the United States, they persist in the world. And as long as they persist in the world, then we too will be suffering from those diseases. It's a small world now. You can hop on a plane and be anywhere in 10 or 12 hours. And so if we're not immunized, we run the risk of sharing the disease with other people. Vaccine is one of the best ways that parents can protect infants and children. Vaccine preventable illness, of which there are 16 of them in the world now, can prevent illnesses that can be very serious, require hospitalization, or even be deadly in young children and adults. Here we see that $6.2 billion is spent on disease care that could be eradicated if the vaccines were available worldwide. 25 million children are affected by these vaccines that, again, could be given for $2 or $3 a dose. So UNICEF, where this slide came from, works to do that for us. How do the vaccines work? As the injection happens and they trigger a mild form of the disease in the body, which allows the body to build up an immune system, and they can give the immunity to the person or the child, so they no longer need to worry about contracting the disease if they are exposed. There should be minor symptoms, sometimes a little bit of fever, but that's all. It's a minor inconvenience as opposed to living life in an iron lung. Preventing these diseases require on-time immunizations for your entire family, but especially for children. For school-age children, we have a chart by the CDC, which gives us a logical and predictable schedule for diseases, because that's what's important. In order to stay on top of it, you need to have that logical and progression and keep up on the immunizations. Remember that in many states, California, where I live being the first, the personal belief exemption is now null and void. As of July 2016 in California, you can no longer get a personal belief exemption for not immunizing your child. There are still exemptions for medical illness, and homeschooling doesn't require it, and special ed doesn't require it for exclusion. But since they had an outbreak at a water park of measles and at a restaurant in Stockton of measles, they think it's important now that all children be immunized in order to attend school, because the ones that aren't immunized compromise the kids that are. All parents want the best for their children. Making sure that they get immunizations is another way to help keep your children healthy, help the community you live in stay healthy, and help decrease the costs of health care. Thank you so much. Our references today came from Voices for Vaccine, U.S. Fund for UNICEF, and the Center for Disease Control. Have a great day, and please immunize your children.